Panic attacks and heart attacks can unfortunately feel frighteningly similar. We're talking shortness of breath, chest pains, dizziness. So how do you know if your symptoms are anxiety or maybe something bigger like heart disease or heart attack? So to offer some insight this morning, we have Dr. Terrie-Ann Benjamin of Swedish Medical Center here this morning. Doctor, thank you so much for being here.
Thank you.
I feel like I was telling you that this kind of hits close to home because I had a moment in my life where I was having panic attacks. They hit me in my chest and I'm going, oh my gosh, am I having a heart attack? And I feel it's a really scary, it's a really scary thing that they're so similar.
Absolutely, and the symptoms can overlap.
Yeah.
And I can't emphasize enough, if a patient is concerned about whether or not they have a heart attack, they should be evaluated right away. 911, get to the nearest emergency room. But one of the other things that can be done is to try to correlate the symptoms and the duration and the onset with whether or not it's cardiac or whether or not it is anxiety.
So how do you do that when you say coordinate the symptoms? What does that mean?
So when I say correlate, I mean the timing.
Okay.
Is there a particular stressor or external stressor that's leading to the symptoms? Or are the symptoms occurring when you're exerting yourself, when you're very active? And do they go away when you're not as active or when you're at rest? So whether or not the symptoms are happening after you just had a stressful event or as opposed to after you just went for a brisk walk or something like that. And the other thing is duration. If it goes away when you stop doing what you're doing as opposed to going away with breathing exercises and taking deep breaths, that's another clue as to whether or not this may be your heart or maybe anxiety. But I think to err on the side of caution, you should always be evaluated to make sure that something's not being missed.
So we were also talking a little bit during the break here, if there's a test that you can get done, and you said they can actually, if you're really concerned, they can send you home with, what is it, a way to measure your heart rate? A monitor?
A monitor.
Talk about
so
that.
The monitor, well, there are various kinds, but one in particular is something that can continuously monitor your heart rate and rhythm over a period of time. And for some of them, you can actually trigger or have the monitor take note of a specific period in time when you're feeling those symptoms. And then physicians can go back and look at the monitor at the time that you're having the symptoms and see if it correlates to any sort of cardiac rhythm abnormality and give a better idea of whether or not it's just a fast heart rate or if it's an arrhythmia or an abnormal rhythm at that time.
I do feel like this always goes back to, oh, I'm fine, I'm just overreacting, it's not a big deal, but you really have to advocate for your own health.
Absolutely. You have to be your number one advocate. You have to realize that if a heart attack goes untreated or unrecognized, it can lead to, further cardiac abnormalities and further cardiac illness, and it can be fatal. And so it's something that the sooner it's captured, the better everyone does. And whether or not it's realizing it's not a cardiac problem or a heart attack at that time, or realizing that it is, either way, you should be evaluated right away. And if it is anxiety, there are measures that can be taken to help with that as well. So either way, you get treatment.
I feel like even when it comes to anxiety or heart disease, everyone always talks about how stress is a lot more detrimental to our health than I think we all realize.
Absolutely.
What can people do to sort of decrease their stress, especially when it comes to heart health and heart disease? Stress is a problem here.
No, absolutely, and I think that's why there's a lot of push towards like mindfulness, taking a break, taking some time out to reflect on yourself and on the day. For some people, having some sort of healthy routine at the end of the day, whether or not it's going for a walk and clearing your head at the end of the day, running on the treadmill or having dinner or relaxing with a glass of wine, reading a book, taking time out to just only be absorbed in yourself and not with the outside world. I think that can be very helpful. And also just setting limits and boundaries for yourself and for your time, and how much you're going to devote externally and how much you're going to devote to yourself.
This is great information. Thank you so much for being with us.
Thank you very much for having me.
Really appreciate it.